Good morning, everyone. My name is Léopold Vandervliet. I work at the Cancer Center of Sciensano in Belgium, and I'm involved in GA Prevent NCD in the work package 4 on sustainability. So now I will give you a quick overview of the joint action, also explain you the objective of work package 4 and the structure, and then move to the accountability approach we're taking in work package 4, and then move to the European Consortium on Cancer Prevention that we aim to establish in the joint action. So regarding an overview of the joint action, the aim is to reduce the burden of cancer and other NCDs and the common risk factors, both at a personal and societal level, taking an holistic approach to prevention. There are 4 main objectives. The first one is to improve joint capacity of member states to plan and implement cancer and other NCD prevention policy and activities at national, regional, and local level. The second one is to improve data and monitoring system for cancer and other NCDs. The third one is to contribute to reduce social inequalities in cancer and other NCDs. And the last one is to engage with and support key actors in the field of cancer and NCD prevention to facilitate cooperation and joint effort. An important thing to mention is that the project really aligns with the objective of the European Beating Cancer Plan and the Healthy Together EU Non-Communicable Disease Initiative. So the project started this year in January and will last 4 years until December 2027. It is led by Norway. There is 25 countries involved and 106 partners. The total budget is around 95.5 million euro, with the European Commission contribution of 76 million. And there's around 98 pilot action that will be implemented both at the personal and societal level in different work package. So this is an overview of the structure of the joint action. So it is 4 transversal work package. So work package 4 is led by the National Public Health Institute of Slovenia and co-led by Sciensano. And then there's 6 technical work package working on regulation and taxation, healthy living environment, individual at risk, social inequalities, health in whole policy, as well as monitoring. So moving to work package 4, the aim is really to foster the transfer and sustainable integration of the result and outcome of the core joint action work package 5 to 10 into national and European policy. We have 6 objectives within work package 4. The first one is to collect all the sustainability element of the joint action policy and inform decision makers on sustainable approach to improve health determinant and a healthy lifestyle. The second one is to identify windows of opportunities within EU governance mechanism for facilitating the sustainability of the joint action, integrated intervention after the joint action ends. The third one is to ensure sustainability in the field of cancer through the establishment of the European Consortium on Cancer Prevention. The fourth one is to foster the transfer and sustainable integration of the result of the different work package into regional, national, and European policy. The fifth one is to foster synergy with Jakarta, with the aim for higher level of sustainability of the action of while sharing a good approach, knowledge, and experience. And the last one is to encourage integration of best practice results into EU and national system, aligned with the principle of well-being economy. So this is a bit the structure that we're taking in work package 4. So it's divided in 7 different tasks. They're all a bit related to the objective I just mentioned. The really important things to mention is the task 4.2 with the engagement with policymakers at different level. So we're gonna establish a policy. We actually establishing a policy decision-making forum. So it will be a policy advisory board to the joint action consisting of relevant DGs and European Commission agency. And the body will be asked to provide critical feedbacks on the feasibility of implementation of the proposed action recommendation and action at national and EU level. Then we have the national intersectional group. So we expect the different work package 5 to 10 to support those groups, and we hope that they will function as tools for cooperation between various stakeholders connected to different aspects of NCD's prevention. Then we have the network of health attachés at the European level and the WHO level. And the idea is for the network to be approached and regularly informed by the joint action on development at the policy and practice level at least 4 times during the joint action. And the network will be consulted regarding specific policy approach when appropriate. So we have the first meeting coming with the health attaché coming this month. And then we have the networking with youth organizations at EU and national level. And the idea is to engage with those organizations in the comprehensive work package for working process. And then the really important task is also the synthesis and recommendation based in the outcome recommendation inputs for sustainability, healthy public policy, and action from work package 5 to 10. So before delving into the accountability cycle, I want to share the vision concerning sustainability and stakeholder engagement we have in Work Package 4. So in 4 years, we really expect to have a recommendation for the sustainability implementation of prioritized action and policy. We also expect the member state to have a clear understanding of their roles in the accountability cycle of the sustainability plan. We also expect that the European Commission will support member states in the implementation of the sustainability plan. And finally, we expect that the European Consortium on Cancer Prevention will be established and that it will actively contribute to the accountability cycle. So as the workshop today really focus on how to make health promotion practice transferable and sustainable across the different EU contexts. I will explain you a bit more the accountability framework by CRAC from 2014 that will allow us to conceptualize the approach of Work Package 4. So when we talk about accountability, we refer to the principle that individual, organization, and the community are responsible for their action and might be required to explain them to others. So accountability is about creating moments of dialogue to share what is happening, but to ask why this is happening. So when discussing accountability, there's 2 quick questions that need to be considered. Who is accountable and to whom are they accountable? So accountability system established the process for monitoring, analyzing, and improving the performance of individual and institution. And as such, it is a key mechanism for achieving good governance outcome. So the framework we're using in Work Package 4 include 4 key stages. So taking, sharing, holding, and responding to the account. So the first one is to take the account. So it's about the assessment. So the aim is to measure the situation and progress towards targets. So one of the subtasks here will be to follow up the work of Work Package 5 to 10 by searching and exploring the potential of sustainability element in the joint action policy and practice. The second one is to share the account, so it's about the communication. So the aim here is to communicate the result to decision makers and other actors to translate information from monitoring into accessible and compelling evidence for action. So one of the subtasks will be to leverage the policy decision-making forum, members of the UCCP, as well as other key experts identified in Work Package 4 to communicate best practice from pilots and related sustainability action. The third one is to hold the account, it's the enforcement, and this is one of the most challenging steps of the accountability cycle. So the aim is to provide appropriate incentive and disincentive to drive desired action from each set of stakeholders. And one of the subtasks will be to focus on identifying the implementation rules of actors at EU and national level. And the last stage of the accountability cycle is respond to the account. It's about the improvement, and it aims to take action to improve specific areas, environment, and other domains. So now I will explain you a bit more the European Consortium on Cancer Prevention that will ensure the sustainability result of the joint action. So the main goal of the UCCP is to build a momentum on cancer prevention and health promotion at EU level around a common agenda. So over the 4 years and the time of the project, the body will determine its scope, governance, and responsibility in ensuring the sustainability of the action in cancer prevention and health promotion in the EU. And the body will be composed of cancer policy prevention and health determinant decision makers and experts from all EU member states and European Economic Area, as well as representatives from high-level health bodies such as the WHO and DG Santé. The second goal is to strengthen and expand evidence-based prevention culture across the relevant chronic disease spectrum and provide for inclusive action in the broader context of health determinant and structure agency relationship. The third one is to strengthen advocacy by providing information and science-based evidence in the public debate. The fourth one is really to combat lobbies and misinformation and disinformation. And the last one is to help to deploy validated disease prevention and health promotion intervention at your level in accordance with the content of GA Prevent NCD. So there will be 4 key annual EUCCP events. The first one took place this September in Brussels, where all members were invited, as well as the Commission and the WHO, to meet in Brussels and to discuss the need of the EUCCP. The next one will take place in Katowice in Poland in June during the time of the Polish presidency. And this one will be really important because it's going to discuss the term of reference of the body. Then we have a third meeting in Ljubljana in 2026 and a final one in Brussels in 2027. And we hope that the body will be implemented at that time, established. So the sustainability element to allow the consortium to function in the next decade will be explored and recommended as one of the top priority, really regarding the scope, the governance, also the financing and the responsibility. So that thing will really be discussed in Katowice in June. And when we talk about the UCCP, what are the potential for sustainability? So the UCCP is a potential form of guarantee for the accountability cycle. So the body could act as a forum to foster collaboration, knowledge sharing, and implementation across member states. So it's really both sharing and holding the account. And then the body's potential lie in ensuring that advance in one country can be translated and applied across the EU, addressing institutional weakness in governance and financing. So that's it for my side. Thank you.